Okay, guys, we're going to start the workshop. I just wanted to remind everyone that this workshop's being streamed live. So anything you say during the workshop can be recorded and heard over YouTube. This workshop will be available after excuse me, on our YouTube channel. So with that, we're going to start the workshop. We do have refreshments in the back, some tea, some coffee, some cookies, and we'll get started. So I think Katie is our person in the back and is going to open up the first little slide deck just so I can do an introduction of who we are, why we're doing this. Just let me know when you're ready, Katie. Okay, perfect. So for those of you who don't know, except for looking at who's in the audience, so you all know who I am, but for the purposes of it being streamed, I'm Councillor Fisher. I sit on the Township of Ramara, and we started a committee called Rooted in Ramara that we began this last term of council. Can I have the next slide, please? So who we are and the purpose is why we're doing what we're doing. Food insecurity hits very home and very personal to me, which is why I felt that it was very important that we address the access to food and food education in our community, because I know that I was not the only one that was struggling to try to make ends meet. And the next slide, please. So what we do, we've created a community garden space. So we have a seed library. We're offering different programs and workshops like this one. We do cooking classes and different talks in the community in different spaces, which will actually bring me into, I don't want to get ahead of my slides, so I will talk a little bit about our partnerships in a little bit. If I can have the next slide, please. So we have created some successful partnerships with the Ramara Library, with the Simcoe Muskoka District Health Unit, with the Breckenridge Legion, and of course our committee members. We've worked very, very hard. For example, and these are just some of the examples of what we're doing. The Breckenridge Legion, branch 488, has a certified kitchen, so we're able to offer cooking classes. So we have done some cooking classes. We're using the produce out of our community gardens to make affordable and nutritious food, and the focus is shifting a little bit. Like, we have very specific programs. So the last workshop that we ran, it was a few days, it was called Combat Cooking, and we were actually focusing on cooking for one or two people, because we have a lot of people who have life circumstances has changed, they're empty nesters, or maybe they find themselves widowed or widowed, and now need to learn how to bring things in a little bit. The library is offering programs. They're doing snacks and stories coming up. So we've made sure when we planted our gardens this year to have things that would be ready to eat at different times in the summer, so that they can tie their stories with the snacks where they bring the children out and they can eat. And of course, the health unit offering workshops like this, as well as they've been able to coordinate a facilitator training. So we have our slow cooker facilitator training, so we can continue to offer these types of classes. And then our committee members who are hardworking as well. Oh yeah, we also do the make and takes as well. We have a brand new volunteer that helps us out. He and his wife are just new to the community and shoveled 27 bags? 27 bags for potatoes that we're ready to bring home, so that you can grow your potatoes right in the bag. Now the next slide, please. This is just a quote I actually like. I don't really have much to say about it because it kind of speaks for itself. And can I have another slide, please? So of course, for addressing food insecurity, and so the components of food security, these are the key things. Any one of these things is missing, then of course you are not necessarily feeling safe with your ability to access food. And that's something that I strive in many aspects of my life, as well as on council, to make sure that we have a food literate community, and that we can make sure that we have the availability, there is the access, there is the utilization and the sustainability for our our members of the community to meet, whether it's monetarily or within a driving distance. It's just the crux of it. And then the next slide, I think, introduces Charlotte. So I'll sit down and let Charlotte take over. So Charlotte is a public health nurse. She's been a nurse for over 30 years. She's been with the health unit for over 25 years. And she sits on many committees and boards in Ramara and outside Ramara as well. She is chronic disease prevention team. And so part of her hat, and I'm sure she's going to speak a little bit more about it when she can do a much better job introducing herself than I can, and what that encompasses, and why and how she fits in our community. She sits on Rooted in Ramara with us, as well as she sits on our Trails Committee. So she has been able to provide a lot of insights, a lot of resources, including this workshop. So we're very happy and grateful to have her. So I'll sit down and let Charlotte take over. It'll be the new slide deck, please, Katie.
So just like Jen said, I am with the chronic disease prevention team with the Simcoe Muskoka District Health Unit. So I'm based out of the Aurelia office. So I support Ramara, Aurelia, or Madani. I have a colleague in Aurelia who supports Severn and North. So with chronic disease prevention, part of my role is to support anything that is associated with healthy eating and physical activity. So that's why Rooted in Ramara fits in so well. So first slide, Katie. Well, I did work Healthy Babies, Healthy Children for 2 decades before I came to chronic disease prevention. So I have that kind of slant to the way I think about things, is just making sure that our little ones can grow up to be strong and healthy. So I kind of put that all together with the work that I do. So today, we're going to talk about household food insecurity and food affordability in Simcoe, Muskoka. And I've tried to put a Ramara slant on it so it's relevant for all of you. Next slide, Katie. I'm going to put my glasses on now, which means you're all blurry, but I can read my notes. So thank you for coming to learn with me today. I appreciate the opportunity to discuss 2 very important issues. So monitoring food affordability and household food insecurity. So we're going to explore household food insecurity rates, the impacts of household food insecurity on health and communities, effective solutions to address these challenges, and the actions and successes of the Simcoe Muskoka District Health Unit in supporting our local communities. So I hope to provide you with some valuable insights, highlight some strategies that can build a more food secure community. So next slide. So since 1998, Ontario public health agencies have been tasked with monitoring the well-being of our community. So that's not just in terms of health, but also in tracking food affordability and accessibility. So one key tool that we use for this is called the Nutritious Food Basket Survey. So it was updated in 2022. And it's a standardized tool that's used all across Ontario to measure the cost of a nutritious diet. Public health units conduct this service annually, so we just finished doing the newest round for 2025, so we won't have that data till the fall. What I'm presenting to you today is the 2024 data, FYI. Anyway, so we do that annually, and we factor in household incomes alongside housing costs to provide a clearer picture of food affordability. So in Simcoe, Muskoka, how we do that is we price 61 staple food items, and we either virtually or in person, we visit 14 grocery stores to do it. These foods align with Canada's Food Guide, emphasizing affordable, home-prepared meals rich in fruits, vegetables, whole grains, and plant-based proteins, while limiting the processed options. So the nutritious food basket does have some limitations. It does not include convenience foods, so there aren't going to be any potato chips in this survey, right? No snacks, takeouts, restaurant meals, and personal care essentials. None of that is included. It does not account for religious, cultural, or specialized dietary foods, including baby formula and traditional indigenous foods. So none of that is included. And it assumes that people have the time, skills, and equipment to prepare meals, which is not always the case. So those are the limitations to the survey. It's important to note that the nutritious food basket is not a grocery list or budgeting tool. Okay, so I'm not saying these are the 61 food items you should be buying every other week. And I'm not saying that this, when I give you the costs, that's the amount of money you should be putting aside for your groceries. So it's not a grocery list or a budgeting tool. Instead, what it's doing is it's providing us a snapshot of the average cost of a basic nutritious diet in our region. Simcoe, I specifically looked at the Simcoe County data for today. Next slide. So in 2024, the monthly cost of a nutritious food basket in Simcoe County was $437.71 for an individual, $775 for a single parent household with 2 children under 6, and $1,260.64 for a family of 4. So that would be 2 adults between the ages of 31 and 50, and 2 children, one between the ages of 14 and 18, and one between the ages of 4 and 8. So food costs have been steadily increasing. From our family of 4 data, we know that from 2022 to 2023, the monthly cost rose by 7%. And from 2023 to 2024, those costs increased another 3%. So since 2022, the cost has gone up by 10%. So these rising costs make it harder for households, especially those struggling financially, to maintain a nutritious diet. As we move forward, we're going to explore how income plays a crucial role in food security and what these rising costs mean for individuals and families in our communities. So next slide. So to understand how affordable food is, we look at 3 key factors. So we look at income, we look at food, and we look at rent. And by analyzing these together, we create a clear picture of the financial challenges faced by local residents. So for the income data, we use the highest possible incomes people might receive, and this is based on income tax data. So this also assumes that everyone has filed their taxes, right, and applied for all the eligible benefits and credits, showing the maximum amount of money available to households. The food data, of course, comes from the nutritious food basket, and we calculate the average price of those 61 foods and then adjust the numbers based on age and gender to estimate monthly food expenses for different people. I call that the magic math that the nutritionists do, okay? And then we look at the rent data. So rent costs are taken from local data in Simcoe County using the Canadian Mortgage and Housing Corporation's Ontario Market Rental Report. And we average prices for bachelor, 1-bedroom, 2-bedroom, and 3-bedroom units. However, these rent estimates are likely lower than what people are actually paying in today's market, meaning the housing costs that I'll be showing you are likely take up an even bigger slice of the household budget. So it's very conservative. Okay. By combining these 3 pieces, income, food, and rent, we create realistic scenarios that highlight just how hard it can be for people with low incomes in our region to make ends meet. Next slide. So these are the 2024 results. So the 2024 results tell a compelling story about the challenges many households face. The blue bars that you see in the chart, they show the percentage of total income needed to cover both food and rent for different income types. So there's 13 different scenarios basically that are listed up there. The red line, that represents 100% of total income for each scenario. Okay. So the family of 4 with the median income after tax is our comparator. That's the one on the bottom. And for those households that you can see that are relying on social assistance, covering just food and rent often takes up most, if not all or more, of their income, leaving very little for anything else. Right? So these results show that food insecurity isn't just about food. It's deeply connected to income, housing, and systemic inequities. Next slide. So we know that living with low income is strongly linked to household food insecurity. You're going to hear me say that all through the presentation. Household food insecurity is defined as insufficient or uncertain access to food due to financial constraints. Simply put, there isn't enough money for food. It's more than just struggling with grocery bills. It's a highly sensitive measure of material deprivation, being most prevalent among households with low or unstable incomes and low or limited assets and access to credit. So you can see from the diagram that food insecurity isn't just one experience. It exists on a spectrum. So some households might worry about running out of food before they have money to buy more. Some may struggle to afford a balanced diet, leading to poor nutrition. And in the very severest cases, individuals may go hungry, skip meals, or even endure entire days without food because they simply can't afford it. While high food prices play a role, lack of income is the biggest barrier for food insecurity. This issue is even worse in northern and remote areas, including some First Nations communities, where high food costs and low incomes create greater challenges. In late 2022, Statistics Canada reported a 10% rise in food prices. So that's consistent with our local data, right? The highest inflation rate since the 1980s. While everyone feels the impact, low-income households struggle the most as they lack the financial flexibility to absorb the extra costs. Next slide. Household food insecurity remains a significant and persistent issue all across Canada, with rates now at their highest levels in nearly 2 decades of monitoring. Imagine standing in a grocery store, carefully weighing whether to buy fresh produce or stretch your meal with cheaper, less nutritious options. This is the reality for millions of people across Canada. In 2023, nearly 1 in 4 households across the country, that would be 8.7 million people, including 2.1 million children, struggled to put enough food on the table. And the problem isn't getting better. Proof, a leading research group on food insecurity, confirms that food insecurity has continued to worsen and is at the highest levels recorded. While Ontario's food insecurity rate mirrors the national average, so that's 1 in 4 or 24.2%, Simcoe, Muskoka sees an even higher impact with nearly 1 in 3 households affected. So we just got the new data on that too, and it's still at 1 in 3. So that means countless parents skipping meals so their children can eat, senior or older adults stretching every dollar, and students struggling to focus because hunger makes it difficult to concentrate. Behind these statistics are real people, our neighbors, our colleagues, our friends, individuals doing their best, yet facing impossible choices every day. Addressing food insecurity isn't just about the numbers. It's about dignity, health, and ensuring every person in our communities has access to the food they need to thrive. Next slide. So for many individuals and families facing income challenges, meeting basic needs is a constant balancing act. Take the example on the screen. So a family of 4 relying on Ontario Works faces a harsh reality. Their total monthly income falls far short of covering essential costs. Feeding a family a nutritious diet in Ontario costs an average of $1,229 a month. So that's for Ontario. Yet food is often considered a flexible part of the household budget. When money runs short, families adjust their spending, frequently cutting back on food to cover other critical, non-negotiable expenses, such as housing, transportation, clothing, and essentials like heat, hydro, phone service, internet, personal care items, medications, and laundry. So for households struggling financially, food is often sacrificed when the budgets don't stretch far enough. Recreation is another expense that often gets cut, despite being essential to well-being despite being essential for well-being. So for children, activities like sports, arts, and community programs provide stability, friendships, and helps to build resilience, especially for those experiencing challenging home environments. For older adults, staying active and engaged through recreation helps combat loneliness, fosters social connections, and supports both physical and mental well-being. So to truly address food insecurity, we need solutions that improve financial stability and support overall well-being, ensuring people can meet all their basic needs, not just for food. Next slide. Household food insecurity is an issue of insufficient income. So again, I warned you, I'm going to say that all the way through. When families don't have enough money, they can't afford enough food. So however, food insecurity does not affect all households equally. Certain socio-demographic groups face significantly higher risks, often due to financial instability, systemic barriers, and economic disadvantage. So our research identifies that the most vulnerable groups are low-income households, families relying on social assistance or employment insurance, renter households, female lone parent households, people living in rural or urban-rural mixed communities, individuals experiencing racial discrimination, oppression, or exploitation, and children born outside of Canada. So the impact of food insecurity is especially pronounced among young people in Ontario, with 30.7% of those under 18 experiencing food insecurity in 2023, which was the highest rate of any age group. Female lone parent families are particularly affected, with nearly half struggling to afford food. Likewise, systemic income disparities mean that Black and Indigenous communities in Ontario face the highest food insecurity rates at 44.7% and 36.5% respectively. Addressing food insecurity requires targeted solutions that account for financial, social, and systemic barriers, including income source, employment stability, housing type, and family structure. Over the next few slides, we'll explore how these factors shape food insecurity, highlighting the complex realities behind the statistics. So next slide. So of all income-related household characteristics, the group that experiences the highest prevalence and severity of food insecurity are households reliant on social assistance programs. While these households make up only 7 to 9% of food insecure households in the 10 provinces, they are among the most severely impacted. In 2022, and you can see this on the slide, nearly 70% of households in Canada relying on social assistance, such as provincial welfare and disability support, were food insecure. In Ontario, these programs include Ontario Works and the Ontario Disability Support Program. Although intended as a last resort safety net, most recipients still struggle to afford basic necessities, including food. Alarmingly, more than half of these households face moderate to severe food insecurity, putting them at a high risk for serious health consequences. Local data gives us an idea of how many households in Simcoe County depend on social assistance and as a result are likely struggling with food insecurity. So in 2022-2023, Simcoe County had over 7,500 Ontario Works beneficiaries and over 18,000 ODSP beneficiaries, which means thousands of households in our area depend on these programs to get by. While Ontario Works caseloads have decreased over the past decade, reliance on ODSP has surged, rising 65% between 2009-2010 and 2022-2023. Demonstrating the growing financial challenges faced by those with disabilities. In 2022, nearly 1 in 5 lone parent families in Simcoe, Muskoka relied on social assistance, a higher rate than couples and non-family individuals, with the provincial rate even higher at 23.3%. Next slide. While food insecurity rates may appear lower among households relying on employment income, these households actually make up the majority of food insecure households in Canada. In 2022, so that's what's on the slide, 60.2% of food insecure Canadian households reported wages, salaries, or self-employment as their main source of income in the previous year. Having a job does not guarantee enough income to meet basic needs. Those workers who are likely to experience food insecurity include those with low wage, short-term, or precarious jobs, racialized workers facing systemic barriers, individuals juggling multiple jobs to make ends meet, and single-income households supporting multiple dependents. In Ontario, the statistics tell a similar story. More than 50% of food insecure households depend on wages, salaries, or self-employment as their main source of income. This underscores the widespread financial instability affecting our workforce. A high percentage of Ramara's population, and this is from the 2021 census, reports employment income. So I think it's 85.9%. But many of these workers may still struggle financially, especially considering that in Simcoe County, 77.4% of employed individuals were considered low income based on the low income measure after tax. Next slide. As I've mentioned, lack of sufficient income is the strongest predictor of household food insecurity. In Simcoe, Muskoka, households in the lowest income group or quintile experience food insecurity at 4.5 times the rate of those in the highest. To explain that a bit, income is often divided into 5 equal groups called quintiles, with each group representing about 20% of the population. This allows us to compare households with the lowest incomes to those with the highest. And as you can see from the slide, the difference is striking. Next slide. We see differences in the prevalence of low income across Simcoe County and our First Nations communities. While 8.1% of individuals in Simcoe County live with low income, slightly below the provincial average of 10.1%. The rate is 8.9% in Ramara and 12.4% in Ramara First Nations, reflecting how economic conditions vary across our communities. Next slide. Housing and food security are closely connected. In Simcoe, Muskoka, renters are nearly 4 times more likely to experience food insecurity than our homeowners. A key reason is affordability. When rent consumes too much of a household's income, there's often not enough left over for food. Nearly half of Ramara's residents spend at least 30% of their income on housing, a striking figure given that renters make up just 8.7% of all households in the township. With the average monthly rent at $1,276 a month and rising, affordability remains a challenge, especially since Ramara has no subsidized housing. Next slide. Family structure also plays a big role in food insecurity. Lone parent families in Simcoe, Muskoka are at much greater risk. They face food insecurity at more than double the rate of couples with children and over 4 times the rates of couples without children. Lone parent families make up a significant portion of households in both Simcoe County and Ramara. In 2021, Simcoe County had just over 25,000 lone parent families, representing nearly a third of all families, slightly above the provincial average of 30.1%. More than 3/4 of these households were female-led. Ramara shows a similar trend, with 31.1% of families headed by a lone parent, and with 68.4% of those led by women. In total, women-led lone parent families account for around 1 in 5 families in the area. Next slide. So, in Ontario, food insecurity among children aged 1 to 17 has been on the rise. In 2023, nearly 1 in 3, or just over 30% of children lived in food insecure households, up from 20.6% in 2021 and 24.6% in 2022, showing a steady increase over the past 2 years. Babies born to mothers facing household food insecurity are at higher risk for poor nutrition, low birth weight, and developmental delays. They are also more likely to require emergency medical care, highlighting the urgent need for early intervention. As children grow, food insecurity contributes to micronutrient deficiencies, asthma, and school difficulties. It also affects behavioral and cognitive development, contributing to hyperactivity and difficulty maintaining attention, which can interfere with learning. The effects of food insecurity continue into the teen years, impacting mental health, behavior, and academic performance. It's been linked to depression, anxiety, and suicidal thoughts, with severe food insecurity, measured as child hunger, associated with a higher risk of depression and suicidal ideation. Next slide. Food insecurity places a heavy burden on the healthcare system, increasing the risk of hospitalization, longer stays, and higher rates of readmission. Individuals experiencing severe food insecurity face healthcare costs more than twice those of food secure households or individuals. In adulthood, severe food insecurity is associated with a higher risk of premature death and a greater likelihood of infectious diseases, poor oral health, injury, and chronic conditions such as depression, anxiety disorders, heart disease, hypertension, arthritis, back problems, and chronic pain. Adults in food insecure households are also more likely to be diagnosed with multiple chronic conditions, making management even more challenging as financial strain forces difficult trade-offs in healthcare, medication, and nutrition. The health consequences are most severe for those living in severely food insecure households. Beyond individual health impacts, severe economic hardship, often intertwined with household food insecurity, exposes families to unstable environments, limited resources, and social stigma. These conditions make it harder for caregivers to maintain a stable home, further contributing to long-term health and social consequences. Breaking this cycle requires systemic solutions that address the drivers of poverty and food insecurity. Ensuring families and individuals have the resources and opportunities they need is essential for improving health outcomes, reducing healthcare costs, and creating stronger, more resilient communities. Next slide. So since household food insecurity is closely linked to inadequate income, it cannot be solved through food charity. While these programs offer temporary relief for those in urgent need, they do not address the underlying causes. Thank you. Despite Canada's long history of nonprofit food initiatives, food insecurity rates have remained largely unchanged. While food charity offers temporary relief, it remains inaccessible to the many due to barriers like distance, limited hours, lack of transportation, and concerns about stigma and personal dignity. Additionally, culturally appropriate options or accommodations for dietary needs may not be readily available, which can limit effectiveness to serve diverse communities. A 2018 survey found that residents in a Aurelian area reported significant financial insecurity, including struggles to pay bills, insufficient funds for essential items, and difficulty affording nutritious food. Yet many also reported rarely using local food banks, highlighting the complex nature of food insecurity in our region. Framing food charity as a solution to food insecurity shifts the focus away from addressing income inequity and policy improvements. Meaningful progress requires efforts to increase income and support long-term financial stability, ensuring that households can reliably access nutritious food without relying on charity. Next slide. So this is where I get more positive and you guys can be happier about all this. Because I recognize that was a pretty big downer for the morning. So addressing household food insecurity and poverty requires a comprehensive whole community approach. This approach should guide actions that focus on solutions to put more money in people's pockets and ease the financial pressure on household budgets. Economic policies that ensure a sufficient household income are critical to reducing household food insecurity and improving overall financial stability. Next slide. So at the federal and provincial levels, economic policies that ensure income adequacy are needed. Research consistently shows that policies aimed at improving the financial well-being of low-income households can significantly reduce the risk of food insecurity. So key solutions include social assistance rates that reflect real living costs and are indexed to inflation, basic income initiatives, affordable, attainable housing, lower taxes for those living with low income, jobs that offer livable wages, regular hours, and benefits, and improvements to the Canada Child Benefit. While these solutions may seem costly, investing in income security now can lead to long-term savings, such as reduced healthcare costs, which is why I went through all the awful things that can happen when you're food insecure, shorter wait times for medical services, thriving, resilient communities, and healthier individuals and families. Next slide. At the local level, addressing household food insecurity requires a multifaceted approach that tackles financial barriers and strengthens community support systems. Some key strategies include subsidizing public programs and services to improve accessibility for low-income individuals and families, becoming a living wage employer to ensure fair compensation and reduce financial strain on workers, advocating for attainable housing expansion to address affordability challenges, supporting increases in social assistance rates so they reflect real living costs. So there's lots of communities that have passed, that have provided support and advocacy to the federal government and the provincial government. Promoting a guaranteed basic income as a foundation for long-term financial stability, offering free income tax filing clinics to ensure individuals claim all available benefits. You can't get those benefits unless you file your income tax, right? And collaborating with coalitions that actively address poverty and food insecurity, like Rooted in Ramara. So implementing these strategies helps build more equitable and resilient communities, ensuring that everyone has the resources they need to thrive. Next slide. So this talks to what my program does specifically. So we are actively working to address household food insecurity in Simcoe, Muskoka through monitoring, advocacy, collaboration, and community engagement. So monitoring food affordability and household food insecurity rates annually to track trends and inform action. So that's the Nutritious Food Basket Survey. Raising awareness of food insecurity as a critical public health issue. You are all victims of that. Collaborating with local decision makers, municipalities, task groups, food councils, coalitions, and community organizations to develop solutions that promote income adequacy and reduce food insecurity, which is why one of the reasons, other than the fact that I like to garden, that I participate with Rooted in Ramara. Engaging with communities to implement strategies that reduce poverty, strengthen food security, and enhance personal and community resilience. There are opportunities at all levels of government to create meaningful change. We're working intentionally with our partners to drive progress and build a stronger, more equitable future for our communities. Next slide. So many communities are taking action. So this is, again, I'm trying to uplift you because I know I've like really crushed you. So lots of communities are working towards developing poverty reduction strategies and supporting poverty reduction events, implementing subsidized recreation access, adoption of living wage by local employers, sending letters to provincial and federal governments in support of improved incomes, providing transit subsidies or free transit for youth and older adults, and supporting and promoting automatic tax filing and free or low-cost tax clinics. That one is a biggie. So just to give you an example of the impact that might have, in 2023, Information Aurelia processed 1,650 tax returns, which placed $3.7 million back into people's pockets through tax refunds, GST, Trillium, child tax, and climate action incentives. This didn't even include the amount of money tax clients received by being eligible for the $500 rent top-up and the grocery rebate, just because they filed their taxes. So it has a huge impact. So next slide. Now, I debated whether or not to leave this one in, but I thought if there are people that attended that were service providers, this is helpful. The best way you can support clients as a service provider is to intervene, educate, and support clients to access tax and other government benefits and connect them with the resources and services. Filling out the forms is really tough for some of these folks. So just being able to do that and facilitate that process is really important. Next slide. So individual action. So what can you do just as residents, individuals? First of all is doing what you're doing today. So learn and raise awareness. So educate yourself about poverty and household food insecurity. Share what you've learned. Talk about these issues with your family, your friends, your colleagues to keep the conversation going. Raise awareness and encourage others to get involved. You can speak out for change. So as individuals and community groups, we can advocate for policy changes at the provincial and federal levels to support effective income solutions. And we can take action. So even small actions make a difference. Send a letter to your elected officials. You can always reach out to the health unit for a template if you need it. Let me know. Vote to support policies that address food insecurity. Find opportunities to work with others in your community, get involved in poverty or food insecurity initiatives to support meaningful change. Next slide. For those that like data, these are really good data sources for local information. So household food insecurity data, nutritious food basket, and monitoring food affordability data for Simcoe, Muskoka. Muskoka and Simcoe County can be found on our health stats website under economic characteristics. So it's kind of like what the webpage looks like. More data can also be found on the County of Simcoe data portal and the Rural Ontario Institute Wellbeing Dashboard. Next slide. And for those that are super keen and want to learn even that much more, all of these things that I've listed here, they're really good sources. Sometimes it's hard to pick out the good sources and when you're Googling online. Next slide. Any questions? Yeah, it was. Jen did. Yeah, I no problem sharing the slide deck. So yeah. Yeah. And my email's on the next slide too. If you want to email me, I have no problem sharing any of the stuff I've spoke to today. Yeah. I don't know. That would be Jen, do you know? And again, like for the health unit, we don't really, although we recognize that food charity is important for the people that need help now, it's really not the answer. So, well, improving people's access to money so they can buy their own food, right? That's the answer. Putting more money back in people's pockets.
So as a municipality, it's really challenging from the government standpoint to be able to run a food bank. There's a lot of grants and monies that are available to food banks that are charitable organizations. And of course, as a municipality, we're not a charitable organization. So we would have to access funds to help support that in our tax base. So through initiatives like Rooted in Ramara and by creating the partnerships that we've been able to create, we're in very, very, very preliminary talks on what that might look like moving forward. I do know that one of our guests that are here, I don't know if she wants me to identify her or not. Susan Padaliva's in the crowd right now, and she's been working very closely with one of our other residents for the Feeding Families campaign. And there has been donations and by food, donations by gift cards, by donations by money to support our families in need in Ramara. The Legion, both in partnership with Rooted and separate from Rooted in Ramara Committee, also do a lot. Our Lions Club in Ramara purchases a number of the good, I don't want to say how many, but it's a significant amount of good food boxes that can be accessed by our families in need in Ramara. So of course, this is just scratching the surface. And like Charlotte said, we want to create habits and we want to provide the education and the access for people so that they, at some point, kind of very similar to my own personal journey, my own personal story to where I am now. I was a food bank user. I was one that was intimidated and overwhelmed and scared to file my income taxes to access the money resources that would have been available for fear that I might actually owe taxes and not know how I was going to pay them. which is why, it was very important to me last term and to continue into this term and even beyond my terms in council to have initiatives like Rooted in Ramara to provide access, education, and resources to our families so that they can maybe get out of a place where they feel they might be stuck. And I'm speaking those words with personal experience. I'm not trying to speak for everyone who might be feeling some food insecurity in their lives. But for me, that's what it was. I was stuck. I did not know how to get out. And it was through education to be able to not rely heavily on the food banks anymore, to not rely heavily on different programs. It's great to offer a handout, but it's much better to offer a lift up. So these are the types of programs that we're really trying to focus on and Rooted. Food banks certainly fill a gap, but it doesn't really close a gap, and it's a gap that will never be closed by a food bank alone. So we are in talks so that it can fill the gap, because sometimes there are needs where you need an immediate need. There's well, we have our community garden that we have at the Ramara Center, and that is not set up by way of plots where people can go and pay for a plot. It is one garden for anyone to access anytime. I guess in winter you're harvesting snow, but anytime to access. The staff there, the children there, the committee are bringing stuff in as it's getting ripe to pick off the table, or you can go out and access yourself. We are looking at expanding into other areas. The Brecon Legion has a garden that I don't want to say made in partnership yet, because we don't have land use agreement, and our Brecon Legion right now is undergoing major renovation, so it's not safe to access, to be open to the general public right now. But when that happens, that is the intent, is that this area of the township. My vision, which I believe is shared by most members of the committee, is to have a garden in every community in Ramara. So people can go hopefully within walking distance, but we know how big Ramara is, so at least close proximity to access these gardens. We have a seed library at the Ramara Center, so we encourage people. And it's free. You come and get free seeds. We encourage people at the Ramara Center to bring their seeds in at the end of the harvest, so that we're creating an heirloom seed that we know is going to survive in our climate. We know that there's been a successful plant grown from that seed. We do have a lot of companies and a lot of businesses that have supported by way of donations of seeds as well, which is fantastic because it fills in those spaces. But we really are wanting to encourage our residents, and we just refilled it the other day, and it's packed full of seeds. Again, with the different workshops and programs and things that we're doing here, the partnerships that we've created, the rec program is running, the rec department's running programs, the library's running programs, the Legion has opened up the health units all over the place with resources. So we've been very, very, very fortunate. So, to the Rooted in Ramara Committee. So for anybody who's listening online, because I know that the audience isn't, like the question was asked, who would they speak to about private land having a garden on it for residents to access? So yeah, so that would be to the Rooted in Ramara Committee, or reach out to the municipality here and they can direct you in that path. And anyone who wants a copy of this slide presentation, I'm just going to get out a paper, and then you can write down email, so we can send you a PDF version of the slide deck, so that you have access to these resources as well. We will be available. We have the room for a little while yet. So when we're done streaming, just so we're not streaming you can't see or hear anything except for an empty room. When we turn off the feed, like, we will be available for some one-on-ones as well, if there's any further questions.
I think it's important, like, just from what I presented, it is a multifaceted approach, right? Having gardens throughout the township are great and it helps, but that's not going to solve it's not going to fix everything all by itself. Having in jobs that people can work at where they're paid a livable wage, that also helps, right? Being able to access income tax clinics so that they can get all the benefits that they need. Right? That helps put more, anything really that puts more money into people's pockets helps to improve their access in a way that's full of dignity, right? To be able to afford the food that is most appropriate to you instead of, although the food banks serve a great need, they do, and they really help those folks that have nowhere else to go, right? Who are struggling. It's not the answer. It was meant to be a temporary solution in the 80s, and now we're into 2025. So, and it creates, right? And that, again, that's a good point, because I like, whenever I do things, I like to infuse, how is this impacting our youngest residents, right? So if we can build in strategies that helps the kids and the families be able to cope better, right? To take the stress off a bit and from their budget, then that's right. Subsidized rec programs are key, right? That helps kids build skills. And these kids are going to be our future workforce, right? That's important. We want to build the base so that when they grow up, they can work a job that makes the money that they need to acquire all their basic needs. So.
Tax season, they had file. I don't think it's possible. I'm not really sure. We just don't necessarily. Taxes.
So again, for people who are listening, the question was asked about filing taxes and how what programs or assistances might be available to help. So in Ramara, currently, we do not have a tax clinic. Information Aurelia, and I know Charlotte can speak more about that, and the Salvation Army in Aurelia do have that program. However, that being said, with Charlotte's passion about making sure everyone files their taxes, very pushy, very pushy. It's okay. We still adore her. The library, with our partnerships, we have been able to engage in conversation, and they are looking, and I'm not sure where they're at. I don't have any authority to speak on behalf of the library, but they are looking at getting a tax clinic program ready for the next tax year, I believe, to help residents so that we have somewhere in Aurelia or in Ramara to come to. But for the time being, the Salvation Army and Information Aurelia do have those programs available to help. We did look at possibly partnering with Information Aurelia, and I'm not sure that will or will not. So we're still in very early, if that will fit our needs that we have in the rural community or not. So I think that's why the library has kind of decided to hold on to that one and really make it a focus. The greatest thing about our committee is that we do have amazing partnerships, but we all have different hats at the table. So we also have to remember to let things be siloed where they need to be siloed. And the outreach that the library has with the amount of patrons that they have go through their door and access the resources both online and in person, between programming, renting of materials, just the availability and the outreach, we kind of felt that was probably the most effective way to get the information out there to reach as many people as possible for a tax clinic. So we are hoping that something will be organized for this year's taxes for next year through the library. Yep. Do you want the? Yeah. Yeah, it really, the gardens and the seed library is kind of what started as our day one kind of thing that we were looking at doing to, of course, make it bigger. And again, because of the lived experience, there's a whole opportunity to bring some dignity and self-worth back into people's lives who feel, as I did, because maybe not everyone feels this way, so I do not want to speak on behalf of everyone who might be in a food insecure household. I went days without eating because I had 4 chicken nuggets to share with my 2 kids. And the dignity that was stripped from me was unbearable. So by providing the education for families and individuals to be able to access and maintain that dignity and that sense of pride and teach it to their children, or with their children's program, even bring it home to teach it to their parents. Just that in itself, it wasn't an embarrassment that I had to line up at the food bank. It was a shame. I felt shame and that I failed my family. That's why Rooted in Ramara is so close to home for me, and why I brought it to council last term. And with the blessings and support of council, we were able to bring it to light. And it's grown, pardon the pun, even bigger than I'd even hoped it to be, with so much more on the horizon and so much more opportunity. It's amazing. So, Joe, you had a question? Yeah. Yeah. Yep. Yeah. And
Start off the tower. See which side of it. Food programs. Changing positions. She sticks. Wheels. Take teeth. Slowly building up. Control. Food program. Family history.
No. Yeah, and that's what we're looking at doing with these different gardens and outreach. And previously, I'm not with the school board anymore, but the schools that I were in, both of them had gardens. And they were managed by the students and some teacher volunteers. And same thing, we fed the students out of those gardens. The food council in the high school that I was is still going strong. So it's getting there. It's a work. It's a progress. And having these workshops like this and creating these dialogues, like this is what we need, right? But then we need to take those talks and put them into action and come up with a strategy. And I think we have a pretty good work plan, and it's in our work plan to provide these workshops, to get these ideas, to reach out, to find the people in our community that maybe we didn't know how to get a hold of, to say, hey, can you help? What can you teach us? What can you show us to make them even bigger? I know our stream is supposed to be till 11, so I think I'm going to ask Katie to maybe turn off the stream, because I'm not sure how well the questions are being heard from the audience, but I know I'm going to still be here. I think Charlotte's still here for a little bit as well. Plus we have cookies to eat. I mean, speaking... They're oatmeal cookies. They're oatmeal. Oatmeal is healthy. Oatmeal is one of the food groups. And there's water, there's tea and coffee. So we'll be available. And again, I'm going to pull out the paper so that we can get emails down for anyone that does want a copy of the slide deck. This presentation was streamed live and will be available on the Township of YouTube channel. And that's subliminal. That's subliminal. And not yet. Well, not today. And so that's where we're at. So I want to thank everyone for coming. I especially want to thank Charlotte for coming and being here.